everyone, and welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. I am glad to be back. Today we're going to talk about a topic that was requested by you. Okay, it's all about breast abscess. Breast abscess is a topic that I have mentioned before, but time and again I still see women coming to my clinic with breast abscess. And as far as I'm concerned, no woman in this world should get breast abscess because it's totally preventable. It's totally preventable, and yet we still see a lot of women with breast abscess in my clinic. So that is why when I received this question from one of you, I have decided to run this video all over again, but maybe in a slightly different approach. So breastfeeding, breastfeeding is a postnatal period, and women in their postnatal period, they are usually undergoing a lot of stress. It's not easy, okay, to be a new mother, starting all over again as a new mother. A lot of things you need to do, and breastfeeding journey has never been easy in the early stages as well as all the way towards the late stages as well. So that is why it's not easy to breastfeed, and on top of that, when you have breast abscess, it can be really devastating to many mothers, and many mothers, because of breast abscess, even end up having a postnatal depression, being very depressed and want to stop breastfeeding, always crying and just very lost and do not know what is best for them. Breast abscess is actually very simple. Just few things. Breast abscess don't come out of nowhere. You always start with number 1, blocked ducts, mastitis, abscess, or straight away mastitis without blocked duct but followed by abscess. So you see, abscess don't form overnight. It takes time to form. Then why do these women still come to us with abscess? And that is what I feel very sad about. That is what I'm sad about, because I still time and again see women coming to me with breast abscess. So if you were to treat the woman at the stage of mastitis, or treat the woman at the stage of blocked duct, then you will never have breast abscess. Then why is it that women, so many breastfeeding women, still come to me at the stage of breast abscess? The answer is quite simple. It's all because no antibiotics were given early enough. Now the key word is early enough. Some of them got the antibiotic only after they already have the abscess, which is too late. This particular lady who gave me this message was very unique in its own way, because she said that she has an abscess and she has gone for aspiration and antibiotics. It's not working, and she's actually thinking of going for surgery, and she was asking me whether surgery was the right option for her. My answer would be definitely no. Why? Because I have this one mother that was very interesting. She was admitted to a government hospital with breast abscess. In fact, it was both sides having abscess. One bigger abscess, one smaller abscess. So I do not know why, but the government hospital did the surgery for the side with a bigger abscess, and the one that has a smaller abscess, they didn't do anything. And in fact, they just started her antibiotic and asked her to go home. But breast abscess, when we do surgery, it doesn't end with just a surgery. We need to do dressing every day. You see, it's not like other surgery where after you cut, you will stitch up, right? But in breast abscess, even after you cut, you clear off all the pus. Normally, we don't stitch up. So we leave the hole still open, and she's supposed to do dressing every day. So somehow she came to my clinic to do the dressing. And then she told me that she feels that the other breast is getting bigger, as it feels like as though the abscess is increasing in size. So what did we do? We did a scan for her the other side, and true enough, there was another abscess on the other side. So I remember she has an abscess operated on the right, and now she also have an abscess on the left. But as usual, for me, I do not operate on my breast abscess. What I do is I just aspirate. I put a needle in and I just aspirate everything out. And I don't aspirate every day. I aspirate like a few days once, but as far as the abscess that she has been operated on, that needs dressing every day. So what happened with this lady is she'll come to my clinic, one side do dressing and one side aspirate. I tell you, I really pity her. For those of you who know what it's like, it's very painful. In fact, many mothers will already say that aspiration is very painful. But trust me, that when I see this lady, when I aspirate, she was quiet. When we were doing the dressing for her, she was shouting. So the point I'm trying to tell you today is abscess, the dressing that you need to do after the surgery, is more painful than the aspiration. So sometimes when you look at aspiration, it looks like The pus doesn't go off immediately. It takes time. You need to aspirate again and again and again and again. But we don't do it every day. Maybe 3 days once, 2 days once, 5 days once, but it's not every day. Yes, it's painful, but you don't need to aspirate every day. And it is not as painful as doing the dressing on the surgical wound. And that you need to do every day. So you look at it, it is actually more suffering for women who have surgery. Yes, the surgery, yes, your abscess is soft instantly. There's no more abscess. But now you have a wound that you need to do dressing every day for the next 2 weeks to 3 weeks. It is horrible and it's an everyday experience. So when this lady asked me this question, she can't come to see me. That's why she asked me. Because she's in Hong Kong, so she can't come to see me. So I told her, definitely an aspiration. Not a surgery, never. But aspiration, you need patience. Because you need to do aspiration again and again and again and again until the whole abscess is clear, until all the pus has been cleared away, which is totally possible. My record, it took almost 3 months to clear this lady's abscess. That is rare, but I don't aspirate her every day. It's like few days once or almost a week. But most mothers, if your abscess is not too bad, we only need to aspirate 2 to 3 times only. So for those who come to see me early, we only need to aspirate 2 to 3 times only. But if you come late, that is why we sometimes need to aspirate up to maybe 10, 20. I mean, the record I have is for over the span of 3 months. But I think I only have one person like that. Most of the mothers I see, less than 1 month, everything will settle. Alright, so aspiration should be your goal. So look for aspiration. And you need to look for aspiration under ultrasound guidance. So in this lady, she also have aspiration, but she finds that aspiration doesn't really solve her problem because the doctor who aspirate for her didn't use the ultrasound. So if I don't use the ultrasound and I put in a needle to go and take out the pus, I can't see inside whether all the pus is out or not. So that is why you need to have ultrasound at the same time, putting the needle in at the same time with the ultrasound, so that I can see clearly where the needle went in and whether the pus is totally drained. Okay, that is how you deal with breast abscess. But in the first place, as I said, no women should have breast abscess. No women. When you have breast abscess, it's always due to something wrong somewhere. Something that someone did wrongly. It's not necessarily the breastfeeding mother. That is why they have breast abscess. Every time a mother comes to me with breast abscess, it only means one thing. She came to me too late. Why? At many levels, something would have happened. Number one, when she had blocked ducts, what did she do? Did she come and see me? No, she did not. She maybe went to see a lady who does breast massage, someone who massaged the breast. Or she may actually engage a lactation consultant when her breast was blocked, which also will do the breast massage. But sometimes you must understand, breast that has blocked ducts more than 48 hours, anything more than 48 hours, if you don't start on antibiotic, you are going to get mastitis already. So if your blocked duct is not over in 48 hours, you're going to get mastitis. So if you see a lactation consultant and she managed to unblock, but it blocked again, maybe after 6 hours, 12 hours, it's blocked again, then you need to start antibiotics already. Can the lactation consultant give you antibiotics? No, unless she's also a doctor. If you go and see the lady who does massage, do you think she can give you antibiotics? No. So the key thing number one is you must start antibiotic within 48 hours from the beginning of your blocked duct. So if you go and see anyone else, very often I notice they will go and see this lady to unblock. Let's say this lady successfully unblocked for her. Then after half a day, it blocked back. Then she will wait another day or two. You're still blocked. Then she will see the lady again to unblock again. That is the problem. Because already more than 48 hours, this problem is not settled. If you do not start antibiotics, there is a very high chance your mastitis is going to come already. Then there's another problem with mothers in general. When you ask them to start antibiotic, then they're thinking, I'm breastfeeding. Can I take medicine? Will the antibiotic affect my baby? You know, they think so much. They think so much up to the extent, by the time they come and see a doctor, it's too late already. So the first mistake is the delayed starting of antibiotic after a blocked duct. Then the second is when mastitis already come. How to know whether it's mastitis or blood duct? Honestly, how to know? Not much difference, honestly, because some blood ducts also have fever. Although mastitis can have fever, also can have no fever. Blood duct also can have pain. Mastitis usually will have pain, but sometimes also no pain. So sometimes you can't tell the difference. So when you have mastitis or you know something is not right, there are some mothers who actually will go and see a doctor. But that doctor, two outcomes. When you go and see a doctor, there are two outcomes. One is the doctor say, hey, you have mastitis or your blood duct looks not so healthy. Better on the safe side, start antibiotic. Oh, thank God she start antibiotic for you early. But there's also another outcome. Some doctors that you see will just tell you, this is just blood duct lah. You go and see a massage lady, you go and see a lactation consultant, or you go and see my nurse, she will express a meal for you and your problem settled. No need antibiotic. I often see that. Because when I get abscess cases, I will ask them why so late. Some of them will tell me, I went to see the doctor, but doctor never give me antibiotic. So some doctors also may not give you antibiotics because they miss the diagnosis of mastitis. It is also something I see very often. That is one problem. There's another problem. Many doctors too, they do not do ultrasound scan for you. They do not do at all. So because mastitis after a few more days form abscess. Abscess is when they have pus. If you have that incy-wincy little pus, that little bit of pus inside, antibiotic would work. But if you have a lot of pus, then of course antibiotic won't work. But a lot of doctors, they do not do ultrasound scan. So they also don't know whether you have pus or not. So basically, if it give you antibiotic, but they never see whether you have pus or not, so once again, it could be delayed. Or the worst thing is I've seen cases where the pus is already there, doctor didn't do an ultrasound scan, don't know that it's a pus, think that it's still blocked up, and send you to the lactation nurse or the lactation consultant. That is worse. And then she thought it's just blocked up. And then the poor consultant or poor nurse will be expressing, and it cannot pass out cannot clear the blocked duct. So-called cannot clear. Your so-called cannot clear the blocked duct. You must think, is it an abscess already? So that's why, what do I do in my center? My center, I have a lactation clinic. The lactation clinic is not even run by me. It's not run by me at all. I have tons of lactation counselors in my clinic. So any lactation mother who comes to see me, number one, we will, if they come with either blocked duct or query mastitis, query abscess, they don't know, right? They just know there's this one patch is painful, it's hard. Or there's this one patch that's painful, not necessarily hard, but it's painful, and I have some fever. So any of these signs, painful, one area that is painful, one area that is hard, or you have fever. So these are the signs we look for. If you tell us any one of these, then in the lactation clinic, they automatically know what to do. First, they will get you to get an ultrasound scan. Because based on the ultrasound scan, I already know. Number one, is it blocked duct? Because in blocked duct, all the ducts are swollen. Number two, is it abscess? On the ultrasound scan, I can see that there is abscess because then I can see pus inside your breast. So if I can see pus inside your breast, I know it's abscess. If I can see all your ducts are swollen with milk inside, then I know you're blocked duct. If I don't see any of this is mastitis. So we know exactly what's wrong with you. Because if it's blocked duct, then I will ask my staff to express the milk for you. In fact, I don't need to ask, she'll do it on her own. And if she can clear the duct, and I look at her case, how many days does she have this blocked duct? If it's more than 48 hours, even though my nurse can clear the duct, I would still start her on antibiotic. If let's say we scan is mastitis, then definitely antibiotic. If we know it's abscess, then my nurse will say she needs to see me, because that is when I will aspirate the abscess. So you see, our ultrasound scan can see a lot of things. But the problem is, majority are not scanning. If you think you have a breast abscess problem, you go to Clinic Kesihatan, they are not going to scan for you. That is definite. Because they don't have expertise in the Clinic Kesihatan to scan for the breast. You go to many GP clinics, also they have no ultrasound machine to scan the breast. So again, it will be missed. You have a lot of gynaes. A lot of people like to go to gynaes, but a lot of gynaes also do not have the ultrasound to scan the breast, because we have ultrasound machine, but we don't have the breast setting, you know. For breast, it's a different probe altogether. It's not the same that you use to scan your tummy to look at your baby. No, it is a different probe. And many gynaes also do not have a breast ultrasound probe. So as a result, you're not getting the scan. And when you're not getting the scan, sometimes the diagnosis will be wrong. So because the diagnosis is wrong, then the antibiotic and the treatment that's given to you is wrong. If let's say the doctor missed the abscess, just give you antibiotic. No use. Your abscess is going to grow bigger and bigger and bigger. And when you come to us, it's like, oh my God, so bad already. So now you understand, no women should get a breast abscess. When you get a breast abscess, it's always due to something not done correctly. Any mother who tells you that she thinks that she may have an abscess or blocked duct or mastitis must have an ultrasound scan done. If not, you will miss the abscess or the mastitis. If you don't have an ultrasound scan done, just give antibiotics first and give them 2 days. If the mastitis or the fever or whatever doesn't go away after 2 days of antibiotic, you must do an ultrasound scan. So a general guide to anyone who is managing breastfeeding mothers. Because it's not just doctors. We're talking about lactation consultants. We are talking about people who massage breastfeeding mothers. Simple principle. Block duct more than 2 days, start antibiotic. After antibiotic more than 2 days, not well, scan. Okay? Simple. If you think it's mastitis, start antibiotic. 2 days after, not well, scan. Don't wait. Don't delay. Don't wait until your antibiotic has finished 1 week and you wonder why you're still not well. Then only you go and go see doctor again. That's too late. That's too late. Because if you have an abscess, that's why your antibiotic didn't work. You wait another week, your abscess would have been so much bigger and you will need so many more aspirations. As I mentioned in the earlier part of the video, aspirations are quite painful. We do not want to do it on you. And I really don't want to aspirate women. And I also don't want to aspirate women so many times because they are really in pain. But I don't have a choice when you come to me as an abscess. Because if I don't aspirate for you, the other option is a surgery. And as I mentioned at the beginning where I shared the case, the dressing after the surgery is more painful than the aspiration. So you better have an aspiration than to have a surgery. Surgery, the dressing is very painful and you have a big wound that you need to take care. Life cannot be normal because you have a wound, big wound on your breast. Aspiration, when you aspirate, it's just like blood taking. After the aspiration, I send you home, life is as normal. You don't need to aspirate every day. So life is a lot better, not too much of pain and suffering. Alright, so I hope all of you get this very simple message. Block duct 48 hours, not relieved or keep coming back, antibiotics. Antibiotics more than 48 hours, not relief, ultrasound scan. This is the general guide for everyone. But of course, if you come to my center, it's a lot better because we scan you right from the start. We know whether it's blocked duct or it's mastitis or it's abscess right from the start. So we know whether you need antibiotics or whether you need aspiration right from the start. So when you come and see me, don't make appointment to see me. I know it's always very difficult to get my appointment. Always just make an appointment for my lactation clinic. Let my staff see you first. My lactation nurse will assess you. My sonographer will scan you and we already know what's wrong with you and they will let me see all the results and I will decide whether you need to start antibiotics or not and whether you need to see me or not. So that is how you get your appointment as an urgent and immediate appointment. You can walk in fact anytime. Alright? So I hope that all of you will get this important message. So if you want to watch my previous video, which I had last 2 years back, I think, which is on blocked duct, mastitis and abscess, you can watch it in my YouTube channel. So please go to my YouTube channel, yeah? Dr. Tan City Clinic. Please subscribe and like my video and turn on the notification button, yeah? So if you want to know more about breast abscess, you can go there, or anything you want to know about gynae, obstetrics, just go there, okay? Alright, so that's all for now. See you next week, same day, same time. Bye bye.